Hello everyone and welcome to another episode of Ask Dr. Bob, and thank you everybody that was to the Facebook wishing us the best for our 35 plus years in practice. We just have a great time making a difference in people's lives, and today once again I have a word that I had to practice pronouncing for you for the Ask Dr. Bob. But last week I told you I would briefly talk about backpacks, and let me tell you what. Backpacks can create postural challenges for your children. You do not want them carrying a lot of weight, especially if these young girls and young boys start being in that forward posture. You want the backpack to rest just slightly above their waist. You do not want them overweighted at all. So whatever they could put in there, the least amount of weight would be to their advantage. And I would personally try to put the books probably closest to the low back, right by the pelvis, so that they're evenly carrying the weight distribution. You just don't want them too heavy. They're better off probably to have a backpack and maybe carry another bag with some of the heavier items. I'm just trying to help in that regard. Dr. Bob, is there a solution for a person with, here it goes, Hidradenitis Suppurativa? You say, what the heck is that? Much help is needed for this long-standing problem. So I did a little bit of research on this myself. It's a skin disease commonly affecting areas bearing apocrine, sweat glands, sebaceous glands such as under the arms, under the breast, inner thighs, groin, and buttocks. So here's my hunch, because I did a little bit more research on it from my own experience working with patients, is I would question parasites. Anytime that somebody has chronic skin problems to that degree, do you eat wild game, sushi, or have a cat? The next is blood sugar. A lot of times if somebody has a boil or chronic skin lesions, it could be a blood sugar issue, have the HA1C and the fasting glucose done. And is this happen to be a younger person? From the email it seems like it was a younger child. Could be liver stress. I see a lot of 8 to 12-year-old boys and girls having enlarged livers due to a lot of chemicals in their body. Large pores on the face usually indicate a zinc need. Zinc's important for healing. I would stop dairy, because dairy can create liver distress. Next question. Dr. Bob, I've read taking L-glutamine can help drastically reduce the pain and tiredness associated with fibromyalgia. I would greatly appreciate your thoughts on this. Well, let me clarify this a little bit. First, L-glutamine, you want to look at your carbon dioxide, your CO2, or your bicarbonate on your blood test. If it's, let's say the range is from 20 to 30. If you're down in that lower range, in the 20 or 22 amount, you could use some L-glutamine. L-glutamine is used for a variety of problems, including digestive distress, because you want adequate and proper digestion. But I could tell you what I would use that's probably better than L-glutamine. We use a vegetable-based product called L-lyzine. It's lithium in a vegetable base. It's from Biotics Research Corporation. We have great success with that. But I could tell you also from my experience, you know, the problem sometimes with natural health care, everybody always wants to take something. Here's what I'm going to suggest you do. Eliminate citrus, eliminate sugar. I have found, and especially women over 40 years old, citrus could be a leading cause of fibromyalgia. And I know in the past we talked about pH, and when you have a higher pH, you have a greater chance to have inflammation in fibromyalgia. And then I actually had somebody else ask me, I just noticed it right now, what can I do for fibromyalgia? Fibromyalgia is a symptom or body signal that your adrenal glands are exhausted. Your adrenal glands make natural cortisol. So if I have somebody that has lots of pain and lots of inflammation in their body, I always like to see what they're eating. They usually are eating sugar nearly with every meal. Dr. Bob, I can't seem to stop sweating. What do you suggest? Well, it's kind of interesting. We'll flip back to the adrenal glands again. We talk about this in Dr. Bob's Drugless Guide to Balancing Female Hormones, also the sex book, Sex and Romance, and the book on men's health. Your adrenal glands cause you to have dry skin because they cause blood vessels to constrict. Once the adrenal glands are exhausted, or the sympathetic nervous system is exhausted, the parasympathetic nervous system kicks in and you will sweat profusely. So you might need adrenal gland support. But how we support the parasympathetic nervous system is with super phosphazyme. That happens to be a phosphorus that we use. Dr. Bob, school is starting. What do I feed my kids? That's really important, you know. I use a rice cereal. The product or the brand name is Ehorn, like E-W-H-O-R-N. And you can get it at most stores today. I get one that has no brown rice syrup or anything in it. You could add walnuts to it, shredded coconut, and maybe a few organic raisins. You can never go wrong with a hard-boiled egg or a sunny side up egg for breakfast. Also an apple with some almond butter on it. You know, a turkey patty or chicken patty. I know Applegate makes some really good organic type of products. Any kind of organic animal tissue would be good. I'm going to take you on the wild side right now is maybe start baking some squash or some yams first thing in the morning. You know, if you could put them on time bake and throw some walnuts with them. You know, squash is good. You throw some cinnamon on it. You know, but you want to stay away from the sugary breakfast cereals totally at all. And if you're going to do oatmeal, because they do have steel cut oats, which theoretically should not have any gluten in it, you might want to try that particular grain. Maybe some brown rice, but throw some almonds, so throw some nuts with it also. Last question, doctor. What is the product you recommend for the enzyme lacking causing men and boys to have man boobs? Well, the real problem happens to be too much estrogen. We use a product called calcium D-glucarate that gets the estrogen out of the body. Aromatase. Aromatase is the enzyme that converts testosterone to estrogen. So if you have someone that's using testosterone as a supplement or a patch or some kind of cream on their body, and if you don't have enough aromatase inhibitors, which comes from broccoli, chrysin is another name for it, that itself, if you don't have broccoli, the estrogen gets to proliferate. So it's an aromatase is the enzyme you want to minimize. Calcium D-glucarate helps the liver. You want to stay away from soy. You know, there's so much debate. I had someone come in today that couldn't believe that soy is not good. I'm not saying it's not good. I just don't feel, from my experience, and I've been doing this for 35 years, it promotes optimal health. Next week, what I want to talk about are tips for eggs. So thank you for following us on Facebook and tweeting us and passing this information on. These are so important. And you know, next week is our year anniversary of doing these Ask Dr. Bob's. It's right before Labor Day. So thank you so much for following us and continuing to make a difference in your and other people's lives.